we are going to close this talk with Roeland's Hemsteede perspective on how social protection can play a role to cope COVID-19 negative consequences. Fernando mentioned that health is also related to some economic bad consequences caused by COVID-19. So we would appreciate your insights on how social protection can play a role to mitigate those consequences. The floor is yours.
Thank you very much, Evelyn, and all the others from both the Latin American Society, but also from CIDE for bringing everyone together today around this topic. As Evelyn says, I will today focus on social protection and how that can help in sort of mitigating the impacts of COVID-19. Given the wide range of backgrounds of people that are around, I will start the presentation to just mention briefly what social protection is and what kind of interventions we can think of. Then I will take a closer look at how social protection is arranged in Mexico and what Mexico is currently doing from a social protection perspective to sort of mitigate or respond to COVID-19. The picture I put here on the right, I want to draw your attention to it because a large part of Mexico's population is working in sort of the informal sector, such as market vendors, etc. And that is a group that is particularly prone to the negative consequences, but who we also could reach through social protection. So if we can go to the next slide. So social protection is generally understood to refer to all public and private initiatives that can provide support to poor and vulnerable groups in society and to protect them from a number of livelihood risks with the objective of reducing their poverty and reducing their vulnerability. So I won't go through all of these, but on this typology basically in the figure, you can see social assistance, which generally consists of cash transfers, of public work programs, but also subsidies or school meal programs, etc. So these are direct transfers to people without them first having I will self. So these are programs where people do not have to contribute anything themselves. Another social protection pillar consists of contributory interventions. So here you can think about your healthcare insurance through your employer, or maybe a contributory pension scheme, etc. But those things are very often aimed at the people who are slightly better off and who have a formal sector employment through which they can contribute. Now, lastly, we can think about active labor market policies, which are policies aimed at protecting the labor market and making sure that people can find job once they are looking for it. So why is this, Evelyn? Can you still go to the previous slide? So why is this relevant in response to COVID-19? Well, I think social protection offers a means to reach some of the people who have been negatively affected by the pandemic by directly transferring resources to them or providing them with direct interventions. So this can be direct assistance, but it can also, through the labor market policies, be aimed at reducing the likelihood that they will need immediate assistance. And because social protection systems are generally aimed at the poorest and most vulnerable groups in society, these systems are already in place and they can just be built upon and expanded, as I will explain later, to make sure that you reach these groups without having to devise new systems or to start massive programs of enrolling people into programs when already capacity is stretched and where, because of social distancing, it can be quite difficult to create new registries. Okay, let's go to the next slide. So, from a global perspective, what we have seen is that once COVID-19 started becoming globally recognized as a problem, the expansion of existing or new social protection programs by governments, UN agencies, non-governmental organizations has expanded very rapidly. So mid-March, we had only 48 countries that were implementing some form of support, such as the well-published £1,200 check in the United States, or the British furlough program, whereby companies receive a subsidy basically from the government to retain their employers or employees. But now, 8 weeks later, we see that 171 countries have already adjusted existing programs or are creating new programs. And while that sounds great, there are quite a lot of challenges as well in this process. First of all, we see that social protection interventions in general, including in Mexico, as I will soon come to, are generally directed at the poorest and most vulnerable groups in society, and often aimed at the rural areas. Whereas with COVID-19, we see that a lot of the people who are affected are typically people that wouldn't qualify for social assistance. So these are people who live above the poverty threshold, who live in urban areas, etc. And I think this is also where I want to draw explicit attention to the plight of informal workers who are typically not covered by social protection systems because their income is above the usual threshold for programs. But it means that from the government's point of view, they are not on their radar. They are not registered in a system, etc. However, for them, because they often do not earn enough to have substantial other benefits through unemployment insurance or a proper healthcare insurance, they are particularly at risk as they need to carry out their market trading or whatever to survive. So they are not only exposed at increased risks because of their need to continue to work, but they are also a risk factor in the sense that they're engaged. Now let's move over to Mexico. Yeah, next slide, please, Evelyn. So when we look at Mexico, we see that out of its population of more than 120 million people, approximately 40% lives in poverty, with a large share of those being considered to be extremely poor. And more than half of the poor population consists of women, and about a quarter of the indigenous population is considered to be poor. Here, I think it is important to note that Mexico measures poverty in a multidimensional way. So I'm not only talking about the financial poverty or destitution, but also about people not having access to quality healthcare or quality education. And in times of COVID-19, where we have in general more difficult access to education, to healthcare, etc., it means that the people who are already poor might face even increased burdens. And in Mexico, the ILO estimates that about 60% of the work that is conducted can be classified as as informal work. So you can just imagine that there is an enormous segment of the Mexican population which already before COVID-19 was living a precarious life, and now with the economic downturn they might be faced even more. So in general, Mexico has a range of social protection interventions. Some are social assistance interventions, such as Prospera, that I will talk about, but there are also a lot of health and pension benefits that are directly tied to formal employment, which is a problem at the moment. So what is Prospera, Mexico's flagship social assistance program? Prospera is a very large anti-poverty program reaching about 6 million households with the aim of reducing the intergenerational poverty of people. So it does this by providing direct cash transfers to households, especially households with children, on the condition that children attend schools, that mothers attend healthcare clinic visits, etc. And if people fail to comply with these conditions, they risk losing their benefits. So under the Prospera banner, there are 14 different interventions that are aimed at providing food support to people, school meals, basic health support, an old age pension, subsidies for utilities, etc. And what I think is particularly important here is that, unlike in many other countries, Prospera also covers a large part of the urban population, even though it is still primarily focused on rural areas. But because of that and the fact that COVID-19 has been concentrated in urban areas, I think that's a benefit of the existing system. And I think Prospera has been operating or active under various different program names since 1994, and it is currently delivered by the Ministry of Welfare. But because it has been doing this for 25 years or more than 25 years already, the systems that are in place are fairly robust, and they have been consistently evaluated through their Council for Evaluation of Social Development Policies, which means that it is much more capable of delivering responses now through systems that are already in place. So one way this could be leveraged is by what they call a horizontal expansion of social protection, whereby you see that new people who previously wouldn't qualify for benefits will now be enlisted into the program. So here we can think of the informal workers who are suddenly becoming extra at risk. At the same time, we could see the program expanding vertically, which basically entails increasing the benefits to existing beneficiaries as their needs and their vulnerability increases. So I think the existing programs within Mexico offer quite an opportunity to leverage. And if Evelyn goes to the next slide, I'll discuss some of the ways in which that's currently being done. Yeah, so basically this table shows the different areas of intervention where social protection is currently being expanded or adjusted in response to COVID-19. So in terms of direct transfers, we have seen that the Mexican government has said it will bring or fast-track pension payments to people. So instead of people normally receiving a pension payment every 2 months, now they will get a lump sum payment of 4 months. So the government is bringing forward one of the pension payments. And that might make sense in terms of addressing people's direct needs. But obviously the longer term implication is that if in a couple of months they then do not receive a pension payment anymore, they might still face problems. So it's moving the problem backwards. So I think from a policy perspective there, it's important to think about how do we avoid an increased shock in a few months' time when the effect of this measure has reduced. We've also seen that the government wants to expand its public works program, especially in rural areas. And I won't go into all of the responses in detail, but I think there's two worth flagging. One is a program of concessional loans for micro enterprises, where they can apply for this loan in order to sort of cover their existing running costs and to still have an income. Practice will, of course, have to show out how successful this is in reaching the poorest and most vulnerable micro enterprises, because some might not be officially registered with the state. They might be, bureaucratic hurdles to applying, etc. So the practice will show how successful it is. Another important intervention at the labor market is that the government is not intending to lay off any workers at the moment. So that would provide a lot of protection for the incomes of people working for the government and obviously thereby their households. So what we see happening overall in Mexico in how it leverages social protection is that it is very much focused on intervening in terms of trying to protect jobs and trying to protect people's ability to run their enterprise, but it does so by postponing the financial impact of the current economic downturn. So down the line, a couple of months when people will have to start repaying their loan, or when it no longer becomes feasible to keep everyone employed, there might be a sort of post-COVID hit in terms of the financial impact of things. And I think those were the main things I wanted to share. If Evelyn can move to the final slide. So if you have any questions, obviously I will be happy to answer them. Also, if you're interested in Prospera, there is a lot of information on this program, because it's one of the most widely studied and global examples of how to develop and run a social protection program. Mexico has an annual social protection week where different stakeholders come and talk about how different interventions work and the impacts on things like education, nutrition, etc. Also, at the moment, a platform called socialprotection.org is running a webinar series around COVID-19 and how different countries and systems are able to respond to this. They are all free to access, and I can really recommend that. With that, I want to thank you for your attention and look forward to your questions. Thank you.
Thank you, Roland, very much.